My name is Jacques Hockford. I'm the co-director at the Center for Amputation Reconstruction at NYU Langone. My co-director, Omri Ayalon, and I started the Center for Amputation Reconstruction in 2020. And the impetus for this was that we realized that there wasn't a home for patients who had undergone amputations. They would have the amputations, but after that, what then? Where do they go? Who takes care of them? We realized that this was a real need in the community and both locally and nationally to create a center of excellence for patients who have undergone amputation that really addressed all of the issues that arise once you have an amputation.
My name is Wendy Razzie, and I am the clinical coordinator at the NYU Langone Center for Amputation Reconstruction. So from day one, when a patient calls, they have a direct number where they speak to an actual person that works with the center. They're not run through a call center where, it takes days to hear back from someone. We will coordinate transportation from their initial appointment if they need that. We will get referrals and all of the authorizations from their insurance if that is needed, because, amputation patients really have to focus on their care, their rehabilitation, and that should be their focus.
Hi, my name is Omri Ayalon. I'm an orthopedic surgeon specializing in reconstruction and complex limb pathology. And I'm the co-director here at the Center for Amputation Reconstruction at NYU Langone. Osseointegration is a technique that we offer at our center. We perform osseointegration on upper and lower extremity patients. And osseointegration is a technique that eliminates a traditional socket. The socket is the part of a prosthesis that an arm or a leg fits into and covers the person's skin and muscle and bone. And that can create a lot of problems with skin, sweating, breakdown, infections, and as well as individuals have a tougher time walking or using a prosthesis in a socket. For some people, osseointegration can bypass that completely and can offer a very unique and effective way to attach a prosthesis to the person's bone directly. And so there's nothing resting on the skin, allows people to walk and feel the ground through their own body as opposed through a big piece of plastic around their skin. And we've seen patients enjoy transformative outcomes either using an upper extremity prosthesis or a lower extremity prosthesis. And in the right setting for the right person, it can be a game changer for that person.
I'm Dr. Paul Rai, and I'm the head of rehabilitation medicine at the NYU Langone Center for Amputee Reconstruction. With regards to osseointegration, it is not a solution for all patients. When patient selection is done properly and the right patient is provided the right surgery at the right time, the outcome can be tremendous and patient satisfaction can be what it is that we all hope it is. I have seen firsthand what can be done at the NYU Langone Center for Amputee Reconstruction, and I believe wholeheartedly in the approach that they're taking.
Well, I got injured in August 31st, 2020. Me and my son was behind my car, and a lady just came and from nowhere and hit us. I was in coma for 9 days, and then after that, they cut my leg like 30 days later. In a socket, for me, everything was difficult. You can't even lose weight because the socket was coming off. Ever since I had OI, everything changed on me. I go on vacation, I go to the gym, I go to therapy, I run, I do bicycle. I do everything. Everything is like normal.
So when you're a patient of ours, you are with us very, very intimately at the beginning, all the way through the end of your recovery, which sometimes lasts for many years, because it's not like a typical surgery where you do the surgery and you say goodbye to the doctor. We want to make sure that our patients do very well. And that includes a lot of visits at the beginning, specifically making sure that the wounds heal appropriately and that the rehab is done appropriately to make sure that the implant heals, that the skin heals, that the patient is able to get into their prosthesis in an expeditious manner. And as a result, we are in touch with our patients for a very long time, pretty much for life, to make sure that they do well.
Le doy gracias a NYU Langone por ayudarme.